Hi, hope you're having a great week, or as we get ready to start our week, just wanted to talk to you about another one of our most common visits coming up in the springtime, and that is we're talking about spring allergies or hay fever, or the medical term for it is allergic rhinitis. Allergic rhinitis is one of the symptoms of seasonal allergies. Seasonal allergies are typically worse in the spring than they are at any other time of year for patients. And a lot of complaints that bring people into our urgent care in the springtime, March, April, May, stem from having some type of reaction to allergens. The most common allergens you're going to see in the springtime are things like pollen, ragweed, tree pollen, grass pollen, all kinds of different things like that. Now you can have other allergens that affect you that aren't related to pollens, like pet dander or smoke or different things like that. But for the vast majority of patients that live in this part of the country, their allergies are going to stem from different pollens. What do you do? What are the symptoms? Well, you know the symptoms. When you have seasonal allergies, the symptoms are going to include sneezing, watery eyes, clear runny nose, cough, nasal drainage, itchy eyes. And a lot of times, over-the-counter medicines can treat these acute symptoms or these symptoms that just suddenly onset pretty easily and pretty fantastic. In fact, many of the over-the-counter medicines that are available to you as seasonal allergy medicines 15 years ago were prescription medicines, and you could only get them by going to see a provider. Now they're available. To you over the counter. So a lot of those work really well, but sometimes they don't. What do you need to do if they don't? Well, that's when you need to be seen by a medical professional, and they can help through your history and your exam, try to figure out what is causing these symptoms. Typically, like we said, in this part of the country, it's going to be from pollen of all different kinds of plants and things like that. But there's different medicines we can give you that will shorten your symptoms, and then the biggest thing is preventing them. Left untreated, they can result in infections and other chronic issues, and we want to avoid those. You definitely need to go seek some medical help for your allergies. If you have increased facial pain, fever, shortness of breath, start wheezing, because the allergies themselves can trigger more severe symptoms, whether it be asthma or bronchitis or different things like that. Again, this is an interesting flip-flop because a lot of times kids do really well with severe illnesses, and adults tend to be more symptomatic from those. A lot of times, kiddos are the ones that can have an allergy flare-up that lead to a serious breathing issue. A lot of kids that have both breathing problems, have also have real sensitive skin, and also have allergy issues as well. And those three kind of tend to run together. And so if your kiddo's one of those, you need to kind of keep an eye on them, make sure that their seasonal allergies don't lead to something more serious like asthma flare-ups or things like that. But it's quickly becoming that time of year where as everything starts to bloom, your nose starts to run, you start to cough, you start to have those issues. There are medications to help you, and a lot of times we can do tests and studies to figure out what you're allergic to and how to avoid those. So if you ever have any questions or anything, please seek medical attention. But that's it for this week. Hope you have a great week, and we'll talk to you soon.